Let's talk about human rights abuses for a minute. Everybody knows that China has been running roughshod over the rights of its citizens, but it's not just China. The myth of overpopulation, propagated by the United States government and other dying Western countries, funded by our government and other dying Western countries, including Japan, has been foisted on literally dozens of countries around the world. You know, it's not surprising that when you go to a country like Kenya, which has a very limited budget for health care, and you say to the Kenyan government, we will give you a generous grant of, say, $10 million this year, but you must use it only for family planning programs, that the Kenyan government is likely to say yes to that offer. But of course it begins before that, because the first thing that happens is our aid agency or the British aid agency or the Swedes will go into a country and say to the leadership, you have a population problem. And when the leadership of that country says, no, we don't think we have a population problem, we will say, oh yes you do, and just to underline the point, you won't get any aid from the World Bank, any soft loans from the World Bank, any short-term loans from the International Monetary Fund. You won't get any assistance from any other UN agencies, and by the way, you won't get any aid from us or the other major Western donors until you admit you have a population problem. That concentrates their minds wonderfully, because a lot of these countries are dependent on foreign aid. And so, reluctantly in many cases, these countries in the 70s and 80s said, yes, well, if you think we have a population problem, then yes, we do have a population problem. Now, can we please have foreign aid? And we say, yes, you can, but you have to pass through another wicket first. And the second wicket is, now that you've admitted you have a population problem, you have to set targets and goals for reducing the fertility of your women. You have to have a plan of action. And the country might respond, well, we don't have a plan of action. We don't have that kind of demographic expertise here in Uganda or Kenya or Mali. And we say, don't worry, we do. We have the plan already drawn up. Here it is. And it calls for fertility rates, for example. The plan for Kenya calls for the total fertility rate to be lowered to 2.5 children by the year 2005, which is not very long away now. And we impose that on the Kenyan government. And then we say, now that you've admitted you have a population problem and you have a population plan, here's some funding to carry it out. Now, many of these governments in the third world that were urging in the direction of population control do not have sterling human rights records. They have very bad human rights records. And what are we encouraging them to do in population control programs? We're encouraging them to intervene in the most private decisions of husbands and wives about the number and spacing of their children. We're encouraging them to violate the human rights of their citizens. In fact, we're not just encouraging it, we're funding it, we're promoting it, we give them plans to do it with. So it's not surprising that human rights abuses abound in these programs. In 1995, President Alberto Fujimori of Peru was elected to a second term. His first foreign visitor was Assistant Secretary of State for Population and the Environment, Timothy Wirth. Timothy Wirth came down, former Senator Wirth from Colorado, came down to tell Fujimori that Peru had a population problem. Now, Fujimori was an engineer by training. And he had been the recipient, his government had been the recipient of much family planning foreign aid for the previous 15 years. But he decided, with U.S. encouragement, with the encouragement of USAID, with the encouragement of the United Nations Population Fund, to get very serious about population control. And he set in place a sterilization quota of 100,000 sterilizations a year to be done in his country. And he organized mobile sterilization teams, brought in experts from China and India in organizing sterilization campaigns, and then unleashed these teams on the countryside. And they would go from village to village, putting up banners which said Festivale de Ligaduras, ligation festival. And government officials would go house to house and tell women, Senora, it's time for you to come in and have your tubal ligation. And if they didn't want to come in, they would be visited again and again and again and again until they came in. After all, not only was there a national target of 100,000 sterilizations, there were individual quotas given to doctors and nurses. If you wanted to remain a doctor or nurse in good standing in Peru, where many of the doctors and nurses are government employees, you had to do 2 or 3 sterilizations a month. You had to, the Spanish word for it is captar. You had to captar. You had to get 2 or 3 women, depending on your precise status in the medical profession, to come in for sterilization each month. If you made your quota, then you were patted on the back and given little bonuses and gifts of various kinds. If you failed to meet your quota, you were criticized. You could be demoted. You could even be fired. So targets and quotas were a big part of the project. Meanwhile, our aid agency is standing by quietly applauding the fact that Peru has now finally gotten serious about population control. The United Nations Population Fund is not merely applauding and funding the program, it is serving as the technical secretary for the program, helping to draw up the details of it. So they're all involved in this sterilization campaign. Some of the other tactics they used are also interesting. They would go to women, poor women, who were receiving nutritional subsidies for their children, and they would say, Senora, you have to come in for a sterilization in order to continue on in this food supplement program. In other words, they were using food as a weapon against the hungry women and children to get the women to come in for sterilization. They would go to other women and they would say, Senora, if you would like to get government benefits, you must agree to be sterilized. Now, there's an interesting thing about all of these population control campaigns, and that is they always target the other. The people who are carrying out the campaign, the people in charge, the people who are running it and setting the targets and quotas, don't target people like themselves to be sterilized and aborted and contracepted. Heaven forbid. In their view, you can never have too many people that look like them and talk like them. It's always the other who is targeted. And in the Peruvian case, it wasn't the high-status descendants of Francisco Pizarro living in the capital city of Lima who were being sterilized against their will. It was the Quechua-speaking Indians of the high Andes, the descendants of the Incas, who of course were defeated by Francisco Pizarro, and other groups in Peru. And you see this again and again. India had a very famous sterilization campaign in the 1970s. Some of you may recall it because it was the only major population control campaign that focused on men and not women. See, these campaigns invariably focus on women because women, for the most part, don't fight back. Men can and do. Well, this campaign focused on men. And as soon as it was announced, the head of the World Bank, who was then Robert McNamara, flew to New Delhi to congratulate the Minister of Family Planning on finally getting serious about population control. And this law passed by India called for compulsory sterilization. Clearly compulsory, clearly coercive. And so they began sterilizing. Over the first 6 months of the campaign, they sterilized in excess of 6 million men. But then riots began. In India's major cities, men began taking to the streets by the hundreds of thousands, protesting these actions of the government. But not just every man participated in the riots. There were 2 kinds of rioters. There were Muslims and there were untouchables. You see, because these 2 groups had figured out that they were the targets of the campaign. The campaign was being run by high-caste Brahmins and the like. And of course, they naturally weren't sterilizing Brahmins. You can never have too many Brahmins. But you can have too many untouchables and too many Muslims. And so the campaign focused on the Muslims and the untouchables. When these 2 groups realized who was being targeted they took to the streets. There were demonstrations. It got very nasty. In Sri Lanka, you have the majority Ceylonese targeting the minority Sri Lankans. In Indonesia, you have the Javanese targeting the people who live in Sumatra and the other islands. I could go on and on. It's always the majority targeting the minority, one ethnic group targeting another, one religious group targeting another. In fact, if you look at population control in a global sense, that still holds true. Because isn't population control nothing more than the haves of the world targeting the have-nots? So human rights abuses abound in these programs, but they also undermine primary health care. And it's easy to see why that would happen. That grant of $10 million that goes to the Ministry of Health in Kenya and is designated for use in population control programs is a magnet. It sucks in many doctors and nurses into these programs. And once they're in these programs, they only do what? They only do population control procedures. And they're taken out of the business of treating people who get malaria or dysentery or pneumonia. They're taken out of the business of primary health care. There is a serious problem with medical transmission of AIDS in Africa. That in a poor country like Mali or Somalia or Kenya, that syringes and needles aren't just used once and thrown away. They're used again and again and again until the needle breaks or the syringe wears out. Now, from the beginning of the AIDS epidemic in Africa, we have brought AIDS-positive people together with AIDS-negative people. Why? Because the population controllers in Africa, when AIDS began to be a problem, said to USAID, we're already dealing with sexually transmitted diseases. This is a sexually transmitted disease. It's caused by transmitted by heterosexual sex. So let us deal with it. We will simply integrate the clinics. And so what you have in Africa now are population control organizations that are running integrated clinics where they do, in the same room and with the same equipment, do AIDS treatment programs along with STD programs and family planning programs. Now, what do you think that does? Well, that brings HIV-positive people together with HIV-negative people, and it subjects them to the same kinds of invasive medical procedures. We have sent about 100 million needles and syringes to Africa over the last 10 years to give injections of Depo-Provera, which is a contraceptive that chemically sterilizes a woman for 3 months. Those syringes and needles can be used again and again, and they are used again and again. A couple of recent studies estimate that 70 to 80% of the AIDS cases in Africa were not transmitted by heterosexual sex, but were transmitted by bad medical practice. And so we have been arguing in Washington for the last couple of months that family planning programs and invasive medical procedures and family planning programs, including Depo-Provera injections and other procedures, have been an important cause of the spread of AIDS in Africa. So, population control programs have a lot to answer for.